Welcome to folks that are just joining us now. We're going to spend a few minutes now just waiting, but we are here and very excited to begin as soon as we have a few more people have a chance to enter into the program. Thank you, Lawada, for helping with that. Hello, Teresa.
Hi.
Hi, are you a caregiver?
Yes, I am.
Okay, great. And are you a care? Oh, I see you have to jump up to be in the middle of the screen. Is that it?
I don't know. Uh-huh. Yeah.
You're going to get your aerobic exercise, looks like.
Can you repeat that again?
Oh, it was silly, so I won't bother.
Okay.
Yeah. Yeah. So who are you caregiving for, Teresa?
For it's called the last name is YU. Uh-huh. Yeah,
Okay.
he's over 90 years old. Mhm.
Oh my goodness. Okay. So it sounds like this is not a family member for you. Is that right?
Not a family member, yes.
Okay. Okay,
And
yeah.
and actually besides of that, I'm taking care my brother too, but he's not with IHSS. He had liver transplant.
Ah, okay. So is he living with you, Teresa?
No, no, yeah. So I asked him, but he want his independence.
Yeah.
Yeah, but yeah. So I said, oh, go apply for IHSS because you really do need some help.
Yeah. Yeah. Right. Okay, well, welcome to everyone who's here to uh, get information about caregiving and sleep. We know that this is a very challenging thing often for caregivers, and that's why I put that picture there to make the point. So I am going to do a presentation myself first. I'm a physical therapist, doctor of PT, and a geriatric specialist, and give healthy habits kind of the overview and then some specifics about what is known about good sleep hygiene. Um, this presentation will be in three parts. As I said, the first part I will do about general healthy living, sleep, and general well-being. And then Dr. Wong, who you can see here, um, is a pharmacist at Turo, California, where he has been a assistant professor for many years. And he has worked for and with Daybreak also for many years. We're very grateful for his help in our work with Daybreak. And certainly last but not least is Shanta Gowda. She's joining us. She is a licensed clinical psychologist and a board certified, but she's board certified in behavioral sleep medicine. And she'll also be sharing her information and more about her practice and her guidance for you in this challenging world of caregiving. So part one, as I said, is myself. And part two, Dr. Wong. Part three, Shanta. And this is a link to more information about her. And all of this information will be available to you um, after the conclusion. As soon as we are able, we'll have the recording available, and it will be also very accessible on our newsletter, which I hope you are signed up for and can sign up for. So let me launch, if I could, now into my section. Sleep is not a key issue in physical therapy per se, but exercise certainly is. And exercise is really not possible without other healthy habits, healthy health habits. Um, there is a lot of research now about the effects of chronic sleep deficiency, and it's pretty impressive. I have to say, if you look it up, you'll see that sleep deficiency increases your risk for heart disease, kidney disease, high blood pressure, diabetes, stroke, depression, and obesity. And the connections are strong. Obviously, that would, if you only had one risk factor and it was sleep deficiency, you would probably not have all of these resulting problems. But if you are an older person and you're doing caregiving, sleep is crucial for your physical well-being. The next point here is mental health. And as I'm sure you all can imagine, not getting enough sleep increases your risk for depression, anxiety, and psychosis. So sleep is extremely important. And the catch-22 of not getting enough sleep and increasing, the negative cycle is real. Let's put it that way. Immune system, certainly you look not rested and not as well, and certainly all of that. So being a caregiver, many challenges to getting a good night's sleep, especially if you are living with the care receiver. Now, I know there are many of you who are participating in this who are working through IHSS, and so you get to go home at night. But you still may be worried, you still may not be getting enough sleep. But I do want to talk about if you're living with your loved one, who you're taking care of. Here is the beginning of my, information for you to really focus on. So just like when you're on an airplane, you put the mask on yourself. Here are some general guidelines for you and your care receiver, okay? And I think all of this is mostly obvious, but it just bears repeating, okay? So you want to make sure the person that you're caring for, if they don't think of it, you think of it, make sure they've used the bathroom before bed. You want to have bedside commode or urinal if they are needing such a thing at night. You don't want folks to go to bed hungry nor too full. Being exposed to sunshine is very helpful for sleeping at night. Exercise is also a key, as I think I've already touched on. And, to help this person feel safe at night, that you're there, that they will be taken care of. They don't need to worry about, just giving people the sense of they're not alone. Because like children often feel frightened at night that they're alone. As we age and become more, have more cognitive impairment, these kinds of fears can come back. And then I'm going to spend some time talking about devices that you can use to help you monitor your loved one or whoever you're taking care of, if they're family members or not, and monitoring their safety during the night so you can sleep, but get an alarm or some kind of notice if they need your help. So that is pretty important. And so I'm going to talk now about these devices. You may already know about them, but they are so helpful. I feel it's really important to mention them and let you know that Daybreak can help you purchase these things if financially you need help with that. That is part of the mission of Daybreak. That is the organization presenting this webinar. So alarm pads, that could be on the bed, it could be on the floor, or it could be on a seat. Then there are motion sensors, and then night lights Well, they're not exactly night light. They're LED motion sensor lights, if you will. So anyway, let me go into more detail about this now. So here you see a pad. It's a floor monitor pad. You put it next to the bed and you set it, you turn it on after you get the person in bed. And then when they step on it, once you've activated it, you'll know. Okay. So if they're on their way somewhere, they put their foot down on the floor next to the bed. If that's something that you need to know as a caregiver, this will give you that alarm. So helpful. That could be very helpful. And in my work as a geriatric therapist, this was something we used a lot for caregivers. This next slide is, that first one was a floor alarm. This one is a pad underneath the person sleeping. It's also a pressure sensor. And this one would go under the mattress, well, probably under the sheet. Yeah. You wouldn't want it buried under the mattress. You want it to pick up when the person takes their weight off of the sensor pad. And then this other one here that you can see is for a chair. And likewise, if you're in the kitchen and you're cooking and the person you're taking care of, you're worried they'll get up and fall, you want to know when they stand up, this is a monitor for that. And we'll certainly be able to take some questions if you have them about that. Here are their medical alerts, of which there are many varieties now. There's this type, the pendant, people wear around their neck, and they have to press it to get help if they fall. So the point, I hope, is clear that you would use different devices for different people in various stages of dementia. Yeah. So if the person could press the button, if they had fallen, this would be the type of thing that you might get them, or sometimes smart watches. I will just mention that some of these devices, like smartwatches, can sense if the person has fallen, and it senses it by, it can feel it, the machine itself can sense if it is free falling, if you will, and it's called an accelerometer, and then alert caregivers that are set up to get that information. So these are things that can really help with a good night's sleep for the caregiver. This is another mousetrap, if you will, another gizmo device. So you put it at the bed side, right there next to the bed, the side of the bed, not the bottom of the bed or the top, but the side where they're likely to get out. And you turn on a light, which would shine to a sensor across from it. And not to go into too much detail about how it works, but as the person puts their foot down and breaks the light, if you will, you, the caregiver, will be alerted. So that's another. And here is the smartwatch, which is now so much more available and affordable. Yeah, and in addition to these devices, there are some of these that will alert that help is needed beyond the caregiver. So VitalLink is a local agency that manages this kind of device and care. And as I mentioned, and I'm proud to say, Daybreak can help get these kind of devices for you if it's not financially within your means. I'm going to just launch into a slightly different tact on the subject, and that is just this general and important information about sleep hygiene or good habits. Okay, I have two slides, and this one I think I sort of does everything. So we'll just talk about that here. As mentioned, getting exercise helps with good sleep. And here I am talking about the caregiver. So not just care receiver, getting sunlight, staying in touch with friends and family so that you are not just feeling alone and, just sort of beyond your means, keeping your spirits up, have some fun. Here's some obvious things. Don't drink coffee or other caffeinated beverages too close to sleep, and people have different tolerances. So you have to go by your own experience with that. Um, Similarly with fluid intake, sort of being conscious of what your limit is so that you won't have to get up in the middle of the night. And Dr. Gouda will talk more about how you can use meditation and there's some wonderful things available to help you guide you into a restful place to prepare for sleep. Following your doctor's advice regarding medication. Dr. Wong will talk a lot more about that. Avoiding napping, well, that sounds obvious, but I think again, you sort of have to be your own guide. If you take too long a nap, or that interferes with your sleep, for some people, a short nap is just the thing that they need. Routine at bedtime, going to bed at a similar time every night, waking up at a similar time in the morning. These are things that are shown to be very effective, and Dr. Gauda will talk to us more about that. I'm thinking alcohol, many people think of it as a sedative, which it is, but it is not very helpful for a good quality sleep. It'll help you go to sleep in the short run, but then people wake up and their sleep pattern is very disruptive. You won't have as good quality sleep. That is a really important thing. Alcohol is not helpful. Making your room cool, dark, and quiet. I think that's obvious. Just hearing that advice makes me want to go to sleep. Anyway, all right. So this is just another quickie of the same thing, but actually in this case, we're talking about doing it for your care receiver. Okay, exercise, sunshine, caffeine, fluids, all of what we mentioned for the caregiver, also, of course, for the care receiver. And there we are. That's the what I had to share. And I think I will go ahead and turn this over to Dr. Wong, Adrian, and go ahead, if you would, and share your information, your slides. Okay, yeah, very good. So if there's not any questions now, you'll have some time later, and there's a lot more information for you from Dr. Wong and then Dr. Gouda. Dr. Wong will talk about medications, how they contribute and disturb possibly sleep, and then Dr. Gouda, non-medication related help for sleep. So Dr. Wong, are you ready?
Okay, thank you. So we're going to talk about medications and how it impacts the elderly adult with sleep. And I think this has already been covered, but the quality of sleep is critical for maintaining health, cognitive function, and overall quality of life with elder adults. And with aging, there are various changes in sleep patterns that are very common. And with the number of increased medications elderly take, they also significantly affect sleep quality and patterns. So here are some common sleep disturbances in the elderly. The first one, of course, is insomnia, which is difficulty falling or staying asleep, and frequent awakenings during the night. A lot of people really don't consider this, but actually sleep apnea is a major issue with many of the elder adults. And because of interrupted breathing during the sleep cycle, it's interrupted because all of a sudden the patient wakes up gagging and not getting enough air. And this causes an associated excess of daytime sleepiness. Some other common sleep disturbances, restless leg syndrome. It's an uncomfortable sensation in the legs with an urgent need to really move them. And it really disrupts the ability to fall asleep and stay asleep, not only because of the discomfort, but just the fact that it's a very restless kind of a feeling within the entire body. There are also circadian rhythm disorders in the elderly, and this accounts for a lot of the changes in sleep patterns with the elderly. And so it causes many changes in the sleep-wake cycle for elder adults. And often it causes elder adults to wake up very early in the morning. So I know, like my mother, commonly over the years, she's gotten up at 3 and 4 in the morning and just didn't need any sleep, but required a daytime nap later on. Just a table I found that may be helpful, and it kind of lays out the different things that are medical problems that interrupt sleep and cause insomnia. And you can see many of these disorders are really common with the elderly adult. Anxiety, asthma, bipolar disorder, congestive heart failure, depression, dementia, GERD, menopause. You can see there's many very common kinds of medical disorders that interrupt sleep. And then iatrogenic, it really just means drugs that cause insomnia. So as Susan had mentioned, alcohol is a well-known offender for disrupting sleep. Beta blockers, which is very often used for treatment of heart conditions or blood pressure. Caffeine that we've talked about, diuretics. If you have a nicotine user, antidepressants, steroids, sympathomimetics, which is basically any kind of a stimulant that is kind of amphetamine-like, and it doesn't have to be amphetamine. It could be something as simple as stimulant in your cough and cold medications. Now, of course, there's psychosocial issues too that cause insomnia. And so anything that affects the psyche in any important way makes it very difficult for people to fall asleep because of worry and depression and all different kinds of mental health issues. Okay, the first type of medication affecting sleep I want to talk about are the benzodiazepines. And some examples would be diazepam or Valium, or lorazepam as Ativan, but there are many others. Temazepam, interesting enough, is actually prescribed for sleep. And they are used for both anxiety and sleep disorders, but yet very often they can cause a prolonged sedation, impair cognitive function, and there is a high risk of dependence with these drugs. And just to give you an example for diazepam or Valium, it takes about 96 hours for the body to break down the first part of that drug, and it breaks into several other components that also have active lives. So in a 24-hour cycle of one dose, you have 96 or more hours of accumulation of this drug. So if you take it for any prolonged period, the amount of diazepam in the body just keeps on building and building and building. It's interesting to note also that the benzodiazepines are listed in Beer's criteria, which outlines drugs that are potentially inappropriate to use with elder adults. So be very cautious with these drugs with elder adults. Antidepressants, some can have sedative effects, and others are stimulating and can cause insomnia. And there's some common types, which is the SSRIs, which are the long name of selective serotonin reuptake inhibitors, or the SNRIs, which is selective norepinephrine reuptake inhibitors, and tricyclic antidepressants, which are commonly used very often. Some examples might be sertraline or Zoloft or nortriptyline. There's also Prozac, And interesting enough, Prozac is the most stimulating, and very often taken at bedtime can actually severely disrupt sleep. Sertraline, on the other hand, actually causes sedation. And again, not all, but many of these antidepressants actually potentially can be inappropriate to use with elder adults, just because of the various problems they cause long term. Antihistamines used in allergies and cough and colds, particularly over-the-counter products, cause a lot of drowsiness, but they can really disrupt sleep architecture with patients. Examples may be diphenhydramine or Benadryl, or chlorpheniramine, which is chlortrimeton. And again, these are potentially inappropriate drugs to use with elder adults. This is a class of drugs really that actually has been implicated with increasing the development of Alzheimer's with elderly patients as well. So you can see these are not to be taken lightly. Even your over-the-counter non-sedating antihistamines such as Claritin or loratadine, while it doesn't cause any drowsiness, in some patients can actually cause a mild cognitive impairment with patients, and yet that's something that's not very often talked about. So even though it's over the counter and it says non-drowsy, it may not cause drowsiness, but it can impair the elder adult's thinking a little bit. Another type of medication affecting sleep are your antihypertensives, and these are blood pressure medications that interfere with sleep. I had mentioned earlier the beta blockers. They affect sleep patterns because the drug works directly in the brain, and somehow within the brain itself, it changes the chemical makeup and blocks things and causes different kinds of sleep disturbances. Diuretics or water pills, they're used to manage our fluid retention and blood pressure, but they cause nocturia, which is frequent nighttime urination, disturbing sleep because the patient has to get up very often to go to the bathroom and urinate. And very commonly, furosemide and hydrochlorothiazide are big offenders. Corticosteroids such as prednisone and dexamethasone, these are drugs used for inflammation and autoimmune conditions, but they cause insomnia and mood changes because it releases cortisol into the body, and cortisol as a hormone has a lot of different effects on the brain, including kind of a stimulating activity, although nothing like coffee or caffeine. It's something about that drug that speeds up the feeling of the body itself and causes insomnia as well as the mood changes. So these drugs are really altering sleep architecture because they actually will affect REM sleep and the appropriation of deep sleep, and also has an impact on sleep latency. There's many of these medications that not only cause sedation, but also can increase the amount of time that it takes for a patient to fall asleep. And of course, there are drugs that cause increased nightly awakenings. And also very, very common are daytime sleepiness problems that these medications cause. And this causes a lot of daytime napping, potential impact on good nighttime sleep because they're napping more than they should during the day. And so here's some strategies for managing the medication-related sleep issues. I would really highly recommend a regular medication review with either a pharmacist or a healthcare provider, your doctor, whoever who is well-versed with medications, and consider alternatives if possible, or adjustments to the dose to minimize the impact on sleep. How you take the medications and when that can make a big difference. So, for instance, the diuretics cause you to pee very often, but you don't want to be taking that at bedtime and getting up all night going to the bathroom. So better that this medication be taken early in the morning to minimize the disruption with sleep patterns in the middle of the night. And of course, there are some non-pharmacologic approaches which we cover right after, cognitive behavioral therapy for insomnia, sleep hygiene practices, such as regular schedule and a restful environment, and other such practices that Susan had spoken about earlier. And of course, monitoring and follow-up to make sure that there's a regular follow-up with healthcare providers to assist in the impact of medications on sleep and make the necessary adjustments when they're required. And here's a case example of an 80-year-old woman with insomnia and hypertension. And looking at her medications, she's taking benzodiazepine for sleep, an antihypertensive, beta blocker for high blood pressure, and a diuretic water pill. And the assessment is she has poor sleep quality, wakes up frequently at night, and has daytime drowsiness. So the intervention would be to sleep from the benzodiazepine, which causes sleep disruption issues, to a non-benzo sleep aid of some sort, adjusting the timing of the diuretics from nighttime to a morning, and implementing a cognitive behavioral therapy for insomnia, along with sleep hygiene strategies. And the outcome from doing these interventions would be improved sleep quality and greatly reduced daytime drowsiness. So in summary, the medications can significantly impact sleep in elderly adults, both in direct and indirect effects. And we need a comprehensive approach involving medication review, lifestyle adjustments, and non-pharmacologic treatment to help manage and mitigate some of these sleep disturbances. And so the call to action is to encourage regular evaluations of medication regimens to see if there's any adjustments or changes that can be made to mitigate some of these problems. And to also promote awareness of the impact of medications on sleep and advocate for individualized treatment plans. And that's it. I'll open the floor for questions if anybody has any.
That was a tremendous amount of information for my aging brain. And, it's such a big topic. I know you mentioned a medication review, and I just want to say that must be the ticket. If you or your person you're caring for is having trouble sleeping, to really make it known to your primary care provider, and have that person or yourself assessed in terms of medication or these other sleep problems you mentioned. Wouldn't you say that is with all that information that we now know you really need a doctor your doctor to help you with that? Would you say that would be sort of an upshot of all of that information in a certain way?
Yeah, I gave a lot of information, but the real upshot is identify the problem and communicate for resolution. How's
Yeah.
that for summing it?
I think so. People think that their doctor knows what's going on, but that's, you need to let your doctor know that this is a problem and ask them to help with it. I think that I mean, amazing, but I think that needs to be said.
Yeah, the most obvious.
Yeah,
Thank
very.
you.
Are there any other questions right now?
Yes, this is Teresa and Dr. Wong. So actually, yeah, I'm currently, I mean, taking care of other caregivers, but my husband, because due to identity theft in the for the past 3 or 4 weeks, he's having sleepless night, and just kept repeating, things has been stolen and stuff. So I mean, actually, we already took care of it, but he kept having that. Is that anxiety or? I mean, what can we do about that? Because he's having trouble sleeping.
I'm not sure because the psychological and the medical side of things for diagnosis is kind of outside my scope. But
Mm.
maybe uh, Sharitha, I'm sorry if I mispronounced your name, might have a better way of addressing that question to you.
Okay, thank you. Yeah.
Yeah, yeah, I think that's a good pass off to Dr. Gouda. Yeah.
Yeah, hopefully some of the information I'll share soon will maybe help answer it. And if it doesn't, please ask again, and I'll be happy to answer if I can give any additional information. But I'm going to talk for a little bit about, as a cognitive behavioral sleep specialist, how I help individuals. So this can be applied to yourselves or the, individuals that you're caring for. More specific strategies that might be useful in improving overall sleep, regardless of the concern that you're having. And a strong belief that I have is if you can understand sleep a little bit better, then you have good expectations, realistic expectations for what sleep should look like for your age, what sleep should look like for your time in life. And so a couple of concepts that I'll go over, and I would welcome questions along the way, but I'll certainly leave some minutes at the end as well. Okay. So I wanted to talk about, the sleep. How much sleep do we need? So, I think in the media, we often hear that we need 8 hours of sleep, that everyone needs 8 hours of sleep. And I like to clarify that, that is a generalization, and it's certainly an average. There are many people that need a little bit less than 8 hours, that might need more than 8 hours. And sleep need certainly declines as we get older. So I like for people to sort of think of the amount of sleep that we need as our shoe size. Our shoe size grows from when we're children all the way until we're older, and it plateaus for the bulk of our adult life. But then we do have our feet sometimes shrink in our older adult years, and that's sort of what sleep need is, how many hours of sleep we need. And this is something that you want night after night consistently, not so much that you can get, 5 hours because that's all you have time for tonight and 7 hours the next night. We want to try to get the same amount of sleep consistently night after night. The other thing that I want to talk about is that, sleep architecture. We've heard that phrase a few times today. And what that really means is the different stages of sleep that we cycle through across the night. We go through light stages of sleep where we might feel like we're actually awake. You might notice if you're sitting with someone in the evenings or close to bedtime that their eyes close, that they're sort of nodding off to sleep. But if you said their name, they would kind of jerk awake and say, "No, I was awake. I wasn't sleeping." And that's probably because they were sort of in that transition, stage 1 sleep. And 80% of people who are woken up from that stage genuinely feel like they were awake. And so it's common to feel like you are awake, but your brain is actually getting a light stage of sleep. So we have this light transition stage. We have, a deeper stage, stage 2. But then stage 3 is the stage that we consider deep sleep. A lot of people hear that term deep sleep, and it's only about 20% of our night that we get deep sleep. That is typically in the first half of the night. So the deep sleep that you get, the sort of restorative sleep where you are the hardest to wake up from, that is only in the first few hours of the night. And then typically the rest of the night you're spending in a little bit lighter stages, including as well as REM sleep, our rapid eye movement sleep. So how do you tell if you're getting enough sleep? I would say that what's really important to consider is, am I sleeping enough each night consistently to function at my best during the day? And I know that's kind of a vague description. We don't have a blood test that we can, take quickly to find out, am I sleeping enough? But we want consistency, as much consistency as possible with our sleep quantity at night. And then ask ourselves during the day, was I able to do everything I needed to do? Was I dozing and having difficulty staying awake? Do I need to reach for more caffeine than I typically have? These are some good questions to ask yourself if you're getting enough sleep. And a concept that I don't really have here as a slide, but a concept that that I really want people to think about is, am I sleepy or am I tired? And these are two very distinct concepts. So we can think of sleepiness as a drowsiness, like those are similar concepts. The ability to actually fall asleep. We can feel like our heart slows down, our eyelids get heavy, and we'll actually fall asleep. That's sleepiness. Tiredness or fatigue or exhaustion, those are all synonymous. That is not that you're going to fall asleep, but you might be wiped out. You might feel drained. You might feel low energy. You might say, I've done enough. I can't do anymore, but I'm not necessarily going to fall asleep. And these two things can be really helpful to distinguish the difference between, especially if you're caregiving for someone who's older, because what you want to distinguish is, are they getting enough sleep? Should we prioritize making sure they're getting more sleep at night or getting better quality sleep? Or should we help them manage their fatigue? Because there are dozens of reasons, hundreds of reasons why someone might feel fatigued. And that could be from boredom to maybe too little activity. It can also be too much activity or too little activity, not doing enough or doing too much. You want to strike the right balance. But there are so many other medical and mental health conditions that can lead to fatigue. So things like low blood sugar or dehydration or, caffeine rebound, these things can lead to fatigue. Low mood, depression, anxiety, chronic pain, those are all things that can lead to fatigue as well. Iron levels, thyroid levels, just having the flu. So these are things to consider so that you can really understand, is this person fatigued or sleepy? The other thing that I want to talk about is the difference between insomnia and sleep loss. And this is something, as a behavioral sleep specialist, I hear a lot of that I think is very helpful and relieving for people to hear. Insomnia and sleep loss, people think of them as the same thing. They're quite different. So insomnia is when your body is not helping you fall asleep. You're lying in bed, nothing is getting in your way of being able to sleep, except your body won't allow you to fall asleep, won't help you fall asleep. So full opportunity to sleep, but your sleep ability is gone. That is insomnia. Sleep loss or sleep deprivation is when you don't even have the opportunity, but your body's ability to produce sleep is there. It's sleepy. Examples of this would be if you weren't caring for someone, if you didn't have to be up at night caring for someone or feeding a newborn or staying up late for work, you would be asleep because your body is sleepy, but something is getting in the way of your opportunity. And I think it's really important to make this distinction because sleep loss or sleep deprivation is more detrimental to your overall physical health. That will increase your risk for a lot of different medical conditions, especially cardiovascular related, as opposed to what we call insomnia, which is still very important to treat, but it will have more of an impact on your mood, on your anxiety, perhaps on your stress levels, and your fatigue levels, but not so much the same physical health impact. And so I'll kind of take that to lead into talking about stress and sleep. So I think it's not a secret that when we are stressed, we are not sleeping as well. The more stress that we have, the less quality sleep we are experiencing. And one of the ways that I like for people to think about this is, think about this as a scale from 1 to 100. And let's say 100 is a bear chasing you in the woods. That is, you are in full stress. You're in what we call fight or flight mode. You are going to do anything and everything to protect yourself. That is, of course, going to counter sleep. You're not going to fall asleep when a bear is chasing you. You're going to make sure you're awake. Your body will help you to fight what you need. And I would say that on the other end of the scale, close to 0 or 1, I don't know if anyone lives there. Perhaps, you know, children on the playground are as close to a 1 or 5 as possible. But we tend to live somewhere in between. And so the more stressors we have in life, the more, you know, concerns or anxieties or worries we have throughout the day or throughout life, we start to increase on that scale from 0 to 100. The higher we are on that scale, the more disruptive it is to our sleep. And so what we want to do is to bring that stress level down. And when I'm talking about stress level, if you're interested from a body standpoint, this is our nervous system. This is what we also can present as anxiety. This is where we might feel our heart rate increasing. We might feel our worries. We're thinking about a lot of things at night, awake in bed. This is what I'm talking about. And what are ways to reduce that? So what I like to call them is deliberate relaxation strategies. So these are things that you can do to really relax your mind and body. Things like breathing from your belly. We call it diaphragmatic breathing. We also have things like guided meditation, progressive muscle relaxation. You can call it mindfulness or meditation, whatever you want to call it. I would summarize this for ease to say that all of these things have one thing in common, and that is really narrowing your focus. So if we have a quick minute, I'll give you an example of something that you can do that's one of the easiest ways to narrow your focus. And I want you to just sort of, you can close your eyes, think of your favorite food. Imagine it in your mind, your all-time favorite food. And I want you to go through all 5 senses with this image in your mind. So first, since you're imagining it, we'll talk about sight. Just tell yourself in your mind, what do you see? I want you to really see all of the ingredients in this favorite food of yours. If you see any drops of oil or any individual pieces of rice or any ingredient on this food, I want you to notice it. And then think of, okay, well, if this food item was in front of me, what would I smell? What would it smell like? Think back to the last time you smelled it. What would it smell like? If you were to take a bite of it, what would it feel like in your mouth or approaching your lips? What would it feel like? What's the texture like? And then what is the sound like if you're eating it? Can you hear, is it crunchy? Is it really soft? Can you hear yourself chewing? If you're envisioning yourself eating this at a restaurant or with family and friends, what would you hear? And this is what you can do. For the sake of time, we'll kind of stop in the exercise, but this is something so simple. And if imagining it is tough, you can just Google a picture or take a photo or look at a photo on your phone of food that you've taken a photo of and just look at it and do the exact same thing. When we focus on all 5 of our senses, it is very hard for our mind to think of the future or to think of the past. And that's what our mind tends to do. It tends to wander to think about what we have to do next or overthink what we've done previously. And that certainly engages our stress levels or engages our nervous system, and that counters sleep. And so one of the best sort of overall strategies for managing sleep, especially if you struggle with falling asleep or waking up in the middle of the night and not being able to fall back asleep, one of the really great strategies is to practice some of these, what we call deliberate relaxation strategies, to really narrow your focus and calm your nervous system, calm your stress system, so that more sleep in your body can unfold. Some other general strategies would be, you know, we've talked about sleep hygiene a little bit. People have mentioned it so far in the webinar, but it is very helpful to kind of protect our sleep environment is how I like to describe it. What that means is making sure that it is dark. Dark is for your safety. You know, you want to make sure that you are safe and that you can see when you need to, but you don't want it to be overly bright when you're sleeping. You want it to be as dark as is feasible. You want it to be quiet. And there are different ways that you can protect your sleep environment from noise. You can use earplugs if that's something that's comfortable to you. You can place white noise or a sound machine, you know, along the walls or windows where outside noise tends to come in. The cooler the bedroom, the better it is for sleep. You want to be comfortable. You don't want it to be too cold, but you want it to be, you don't want to be sweating or overheating. Comfortable mattress. These are the types of things you can do to protect your sleep environment. Another couple of strategies that I'll mention would be if you struggle with what we call insomnia, trouble falling asleep or staying asleep, you don't want to check the time at night. So you do not want to look to see what time is it when you've woken up. Checking the time at night really increases that stress response that I was just talking about. Your mind is suddenly thinking, well, what time is it? How long have I been awake for? Am I going to fall back asleep? What time do I have to get up for the morning? And you've just woken your mind up, which also wakes your body up. So avoiding looking at the time is a great option. The best way to go about this would be to set an alarm for when you know you need to be awake and out of bed for the day if you have a time, you know, obligation. But otherwise, if you wake up at night, it's a reminder to yourself, you know, it doesn't matter what time it is. I'm going to try to relax to fall back to sleep. And it doesn't matter what time it is. My alarm hasn't gone off, so I know it's not time to get up and out of bed. And then lastly, I want to touch on, you know, you've heard the term CBTI, cognitive behavioral therapy for insomnia. You've heard the term sleep hygiene. I just want to share that that is something that this is a treatment that I use with different patients that I work with. It is the most effective treatment for insomnia and for other similar sleep disturbances. And what it does is really kind of assess what is someone doing around their sleep habits. You know, what time are they getting into bed? How much time are they spending in bed? What time are they getting up? How are they spending their days? It really looks at your lifestyle, your sleep habits, and then I give sort of specific strategies for that person and for their lifestyle that will help them optimize their sleep, get them better quality and then better quantity sleep that's appropriate for them. And this is really, we call it cognitive and behavioral because the behavioral piece are things that you can actually do. So things like winding down before bed, not spending too much time, you know, awake in bed, those types of things that you can do, increasing your activity during the day and your sunlight exposure. But the cognitive piece is something that often gets skimmed over. This is where we want to think about, how do I think about sleep? What is my relationship to sleep? When I think about sleep, does it stress me out? Do I get anxious? Do I feel like I have difficulty sleeping? Or do I feel really good about sleep and I'm not worried about it at all? The people who fall in that latter bucket where they don't think about it, those are the people who tend to sleep the best, because sleep is a natural biological process that shouldn't take a lot of effort. The more that you try to sleep, the more that you force it, the less sleep you're going to get. And it's very counterintuitive because it's the only behavior where more effort makes it worse. When it comes to diet and exercise and safety, you have to make an effort. You have to think about it. You have to make changes. You want it to be on your mind, to be, you know, fully aware for good results. But when it comes to sleep, I always say that you want to strike a balance between helpful commitment and harmful effort. So you want to be helpful and you want to stay committed to getting good sleep. But if you're trying too hard, if you're trying to perfect it, if you're worrying about it, that's harmful effort. So we want to stay in the category of helpful commitment when it comes to sleep. So I'll pause here, and I'm sorry the slides didn't align. I don't think my slides with some of these images got inserted here. But I can share those with Susan, perhaps if you want to. I can reshare them so that you can include them because it would have fallen along with what I was saying earlier. But I'd love to answer any questions. I'll leave some time here if there are any questions.
Okay. I want to say, Shanta, that there is a question in the chat.
Yes, I just clicked on it.
Yeah.
So nightmares are not, we don't know that they're necessarily more common in elderly, in older adults actually, but things that can help for nightmares is honestly trying to help your sleep overall. So cleaning, I call it cleaning up your sleep, trying to consolidate. A lot of times people who experience nightmares have fragmented sleep. So maybe they'll take a little while to fall asleep, or they'll wake up a few times in the middle of the night and they'll be up for a little while. So sometimes improving the quality by consolidating, so spending a little less time in bed can be helpful, like getting into bed a little later or setting your alarm and getting up and out of bed earlier. That can help nightmares in and of itself. Other things to consider would be, a lot of times as people get older, sleep apnea is certainly a big concern. It can get worse as you age. Untreated sleep apnea tends to be most common as you age in the stage of sleep that we have very vivid nightmares. And so it can bring that more to your awareness. It doesn't mean that you have more nightmares as you get older, but you're more aware of them because sleep apnea is waking you up. So perhaps getting evaluated if sleep apnea is something that you might not be treating if you might have it, if you snore loudly or if your doctor has mentioned any other signs for sleep apnea.
How, I don't see any questions right now, so I wanted to ask you, Shanta, how long does it take, if you were to give us an idea, how long does it take to help somebody get on top of the sort of vicious cycle of anxiety?
Yeah. It's a great question, Susan. Not long, to be honest. It just depends on the person and how maybe intense or how severe, for lack of a better word, the anxiety and rumination is. But when it comes to sleep, if the anxiety and worry is related to sleep, a handful of sessions is all in my experience. I've been treating sleep problems for 10 to 15 years now, and a handful of sessions to really learn what healthy sleep looks like for your age, what the right expectations are, and learning these different strategies is enough in and of itself sometimes to kind of get out of that vicious cycle. Because once you start seeing your sleep improve, your confidence in your sleep builds, and then that vicious cycle sort of diminishes. But there are very specific cognitive strategies, like ways to manage the worry and offload it and journaling and things like that. That I do depending on the person and their rumination. So in short, it doesn't take long to learn these skills. And the more that you implement it, the better that you get at it. I do see one more question in the chat, and is it good to have music on when having trouble sleeping? Music and TV, any noise at night, the best thing to do is to make sure that it is consistent. So if you have music, typically I would say you would want it to be like so calm, soft, and sort of cyclical, because you don't want any like loud changes in intonation or anything like that. That's why I don't recommend TV while you're sleeping, or have the TV timer on so that it'll turn off after 10 minutes or so, because our brain, even though we're asleep, it's still trying to pick up on cues to make sure we're safe. So when a new character is talking, or when there's a loud noise or any change in intonation at all, our brain might be sort of kind of half waking up to check, are we okay? Oh, that was just the TV. Even though we may not wake up from sleep, it's still disrupting our sleep in some way that we're not noticing. So that's why white noise, or just a very consistent, like do, 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 like the same sort of pattern music is okay. But general music with lyrics and stuff, I don't really recommend.
I noticed in your website, Shanta, that you offer a 15-minute consultation, and that's very generous. And I'm thinking maybe folks here will be sure that your website, the links and so on, are available.
Certainly. Yeah, the 15 minutes is usually to make sure that if anyone has a question or two that I could answer, or if they're interested in perhaps scheduling an appointment with me to make sure that whatever concern you're experiencing, that I would be the right fit to be able to help you with that. Or if I can guide you to another resource that might be more appropriate. So you can certainly book directly. Once you have my website, if this is something that interests you, you can certainly book directly into my schedule.
One more thing I want to talk about is sleep apnea, which is, I believe, pretty common. And folks don't often know. I mean, usually the people they live with know, but they don't know. And so that is something that is, wouldn't you say, Shanta, really important to treat?
Absolutely. So sleep apnea is essentially like what people kind of associate it with wearing the CPAP machine, and it's where your airway is sort of obstructed when you're sleeping, and so your lungs aren't able to get full oxygen. Your oxygen levels might drop. It's extremely critical to treat because untreated sleep apnea is what causes some of that sleep deprivation that we spoke about, and that increases your risk of all kinds of cardiovascular problems. So, stroke, heart attack, even diabetes, high blood pressure to start, you name it. Every organ system is impacted with untreated sleep apnea. It does get worse as you age, especially in men, and then women, once they hit about 50, it's the same rate of increase. So certainly something to evaluate. Some key signs are loud snoring. If you feel like you're still getting a decent amount of sleep at night, but you're still feeling sleepy and drowsy during the day, any family history of sleep apnea will also be a good risk. It's something great to talk about with your primary care provider or sleep specialist if you have one.
Thank you so much, Shanta and
My
Dr.
pleasure.
Yes, any more questions you have, you can send them to us at Daybreak. If you aren't already on our mailing list and you want to get our newsletter with information for caregivers, and this particular webinar will be featured in the next webinar along with the link. Just before we close, are there any more questions or comments people would like to share? We're so grateful that you've come and spent your time and hope this is helpful. Thank you again. Thank you all.